presentation is being recorded. However, when we get to the Q&A part, it will no longer be recorded. We ask that you remain on mute through the presentation. If you do have questions that you think of as the presentation is going on, feel free to type them into the chat and we will address them during the Q&A session. As Heidi said, the slides and any unanswered questions will be emailed to any registered participants. And finally, we ask that this remain a safe space. So if participants choose to share any personal information or opinions, we ask that that remain within this group and is not discussed outside of this discussion. Throughout today's presentation, we're going to talk about your protected health information, also known as PHI, and what healthcare providers must do to keep that information safe. Also, who has access to your PHI, how you can protect your own PHI, and then what to do if your rights are being denied or your PHI is not being protected. In 1996, the Health Insurance Portability and Accountability Act was passed, and this is what we commonly know as HIPAA. And it did several things. So one, it provided easy access to individuals to get health insurance. It set certain standards that would help reduce healthcare fraud and abuse. It set standards for how healthcare information should be handled when it came to electronic billing and other processes. And then it also set standards of how protected health information should be handled. And this is what we are going to focus on today. In addition, the HIPAA Act also set certain rules. So it created the security rule, which sets standards of how PHI is created, received, maintained, or transmitted in electronic form. It developed the privacy rule, which created standards for individuals' rights to understand and control how their health information is used. And then it established the breach notification rule. So it set certain requirements that covered entities must notify patients if there was an unauthorized access to their PHI. We're going to touch upon all of these rules throughout the presentation today. So what is PHI? PHI is any information in a medical record that can be used to identify an individual and that was created, used, or disclosed while providing a healthcare service. Now, different healthcare providers or entities might use terminology. So you might see medical record, you might see health record, or you might even see something called designated set. Essentially, they all mean the same thing. It is your health or medical record. On this slide, we have a few examples of PHI. So some of them you're probably very familiar with and know that they're examples of PHI. So your address or your phone number. Any numbers that identify you. So your social security number, it could be your driver license number, an MA number, and then your birth date. But then there's also some on this list that you might not have known were considered PHI. For example, the name of a school that you or your loved one attends, an employer, the name of your medical providers, or even photographs can be considered PHI. So anyone who is designated a covered entity or a business associated to a covered entity is required to follow HIPAA laws. So examples of covered entities could be healthcare providers, health plans, or healthcare clearinghouses. The coordinating center is a covered entity, so we must abide by the HIPAA laws. On the right-hand side of this chart, you will see businesses and organizations that may not be considered covered entities, but they might have their own standards that they might have to adhere to. So, for instance, legal, lawyers have certain standards that they must follow. The same is true for anyone in the financial field. Though some of those organizations and entities that are listed on the right side can be a business associate to a covered entity. So, for example, at the coordinating center, we work with an IT vendor who has designed and maintains our care management information system. So, essentially, the documentation system we use where all our client information is put in. Since they play that role, they are a business associate to the coordinating center, and we are a covered entity. Therefore, our IT vendor must abide by the HIPAA laws as well. A covered entity must provide every patient or client with their notice of privacy practice. And this describes how they use and disclose health information. It must be written in a simple, easy to understand language, and it should have an effective date somewhere listed on it. It also should provide you information of how to contact their privacy officer if you have questions or concerns. So I'm sure most of us are familiar with the first time we go to a new physician, we often receive a notice of privacy practices. And we are often asked to sign a form saying that either we've received those privacy practices or at least we were given the option to receive them. We may have chose we did not need to actually have the physical copy of it. Though they also might direct you to where the privacy practice can be found in other places. So, for instance, at the coordinating center, this screenshot is the bottom of our website, and you can click on the HIPAA notice of privacy practices, and it will take you to ours. The notice of privacy practice should be given to patients and clients upon first treatment. So at the coordinating center, we will either give our notice of privacy practice to our client when we are visiting them for the first time, or if we're sending a welcome packet to the client with some materials in it, we might include the notice of privacy practice then. A healthcare provider may share your information, face-to-face experiences, over the phone, or in writing. So, when can your PHI be shared with other individuals? So, for one, if you are present and do not object to sharing the information. So, example of this is you need to go to the ER and your friend takes you to the ER. You're brought back to a room in the triage area, and your friend is in the room with you, and a physician enters. That physician will ask if you are comfortable with having a discussion with him or her while your friend is present in the room. If you say yes, then the physician will continue on with their conversation with you. If you say no, the physician will ask your friend to step out of the room so they can have a private conversation with you. You do not need to be present for information to be shared if a provider determines it's based on professional judgment that it's in your best interest to share that information. And we'll touch upon that a little bit later in this presentation. And then lastly, your PHI can be shared if you complete a authorization to release PHI form. So you're essentially giving permission for your provider to share information with another individual or entity. So while each healthcare facility or provider has a slightly different notification to release PHI form, there are similarities in them. So I'm going to just show you a few sections of what our notification to release PHI form looks at the coordinating center. So here, this is a section where you're going to denote either the name of the individual or entity that you want personal information to be shared with. Some healthcare facilities and providers might have several sections on their form that looks like this. So potentially you could use the same form and denote information go to a different person or a different entity. Or like at the coordinating center, we have one form for each individual or entity that you're giving permission for information to be shared with. So we wouldn't want you to try to squeeze in information for either multiple individuals or entities in this section. We would just ask you to complete another form. This section here on the coordinating centers form is where you're going to choose what type of information you're giving permission to be released. So in the middle of the form, you can see you can choose either your entire medical record, or you can pick and choose from the list below of what type of information you want released. It is important to know that if you have any mental health information in your record, that information is not automatically going to be shared if you check entire medical record. If you want your mental health information shared, you're going to have to go down to this bottom section and physically check which things you want to be shared related to your medical health information. So this is a slightly new adjustment to one of the HIPAA laws, that no one will just automatically release your mental health information, even if you're saying they can release their whole medical record. You have to give specific permission for anything related to mental health. So when is an authorization of PHI form not needed? So public health. When we were in the throes of COVID, a lot of information was being shared with the CDC, the National Institute of Health, and other agencies. Information was being shared about who had COVID, who they were around, who might have been exposed to COVID as well, who was getting vaccines, when they were getting vaccines, what vaccines were they getting. That was not an instance where we needed to ask individuals permission to share that information. It was considered public health. Another area that relates to not needing a form is around audits. So at the coordinating center, we are sometimes audited by some of our contractors, as well as we participate in accreditation processes. So during those audits and or accreditations, we are often asked to show client files. Again, that's not a place where we need to ask permission from the client because it's considered part of health oversight. If we are dealing with any law enforcement or judicial proceeding, so if we receive a subpoena, we do not need to go to that client and ask them permission. We are required to turn over those records based on what the subpoena said. And then, like I mentioned before, if we have concern for anyone's safety, or if we believe there is a serious threat to one of our clients or other individuals, we do not have to ask permission to disclose PHI. So for instance, if we call 911 and we are asking for a wellness check on one of our clients, we could say to them, this is a client, they're 72 years old, they live at this location. No one has heard from them in the last couple of days. We have concern because they are type 1 diabetic. They may not have access to their medication. All that information that was shared because we are concerned for that client's safety. And again, we don't need to ask permission for that PHI to be shared. So how does the coordinating center keep your information safe? We do several things. So as I mentioned before, we have a case management information system that houses all our client data. We have about 250 coworkers who have access to that system. However, not all 250 coworkers have access to your information. So the only one who has access to your information is either your coordinator, your supports planner, your community health worker, or anyone else that is part of that team that is working with you. Those are the only people who have access to your records in our documentation system. If we are sending PHI externally to someone, we will encrypt our emails. So that is ensuring that when PHI is transmitted electronically, we are making sure that the information in those emails are kept secure. We do not send any text messages that contain PHI. Text messages are not a secure way to communicate. If you as the client choose to start a text conversation with your coordinator, supports planner, or community health worker, and it includes PHI, the individual who is working with you is going to stop the conversation, let you know that text messages are not a secure way to communicate, and that they would like to continue this conversation either via phone call or email. All of our coworkers are trained on policies and procedures of how to protect PHI, both in paper format and electronically. So when coworkers start at the coordinating center, they go through this training. Every coworker is required annually to complete mandatory competencies around PHI, HIPAA, privacy and security rule. And then we also do trainings throughout the year with all our coworkers related to those topics as well. Our laptops and cell phones are encrypted. So if a laptop or cell phone becomes lost or stolen, it is not easy for someone to pick up that device and get the information that is on that computer or cell phone. They are encrypted and they have multi-factor authentication. So it makes it very hard for someone to get information off that device. We also have a disaster recovery plan and a security incident plan. Those plans are reviewed at least on an annual basis, and we do exercises and drills around those plans on an annual basis as well. So we are essentially practicing if for any reason we have to utilize those plans because of either a disaster or some sort of security incident. And then lastly, we have something that's known as a security and event information management system. So essentially, this is a system that monitors our network and systems 24/7. So it is continually looking for odd behavior. So an example might be that it might see that over a short period of time, maybe 30 minutes, a lot of data is being accessed by an individual, and that information is being downloaded to some other location. That would trigger the system to send an alert. The alert would go to our managed service provider, who is an IT vendor who helps us monitor our networks and systems from security perspective. And then that alert would also come to me as well. So we could act quickly to prevent further damage from possibly happening to information on our systems or network. It's important that you know your rights around your protected health information. So, a survey in 2024 revealed that 27% of individuals were unaware or didn't believe they had a right to an electronic copy of their medical record. And then 41% of Americans have never even seen what their health information looks like electronically. So here are your rights as it pertains to PHI and your information. So you can ask to see or get a copy of your medical records and other health information from any provider or healthcare facility. Now, each provider or healthcare facility might have their own process of how you would make that request. Some facilities have you fill out a form. For us at the coordinating center, you can make that request in several different ways. So you can ask for a copy of your medical record from your coordinator, your supports planner, or your community health worker, whether you're asking them in person, over the phone, or in an email. As the privacy officer, you can make that same request to me. We have the obligation to get you that information in 30 days or less. If for some reason we believe that it's going to take us longer than 30 days, we will let you know that. Organizations should be letting you know that as soon as possible. So they shouldn't be waiting to day 29 to inform you, okay, your request is going to take longer than 30 days. When I receive a request for a medical record and personal information at the coordinating center, I always follow up with an acknowledgement that I've received your request. And yes, I believe that we will be able to get your information to you within 30 days. If for some reason I don't believe that's going to happen and we're going to need more time, I will be upfront with you when I respond to your initial request. Another important thing that you may want to do is look at your health records and see if there's any wrong information in your file, or you believe that there's information missing from your file. So when you contact a healthcare facility or healthcare provider, from one of those examples, they have 60 days to either say yes, they will change the information, or they will add the information, or no, they will not. If they do not agree to change the information or include the missing information, you have the right to submit something in writing saying that you disagree with something that is in your health record, and then that written notification should be attached to your health record. You also have the right to ask for and know who has seen your health information. So you can submit a request to a healthcare facility or a provider. I'm requesting to see all the individuals and entities who saw my health information from 2022 to 2024. That is your right to know who has seen your health information in a certain amount of time. So unfortunately, we know that data breaches are very popular, and they're even more so popular when it comes to health information. So in 2024, there were 587 reported data breaches that involved health information. And also in 2024, we had the biggest breach to date, and that was related to 190 million individuals being affected by the Change Healthcare breach that occurred. Organizations who have breaches can face very high penalties. So penalties range from $100 per HIPAA violation up to a maximum of $25,000 per violation category and per year. So you can imagine, especially if this is a smaller independent provider, that a breach of a large amount of files could essentially, put that provider out of business. What are some ways that you can protect your health information? So first off, know where your information is stored. Know which one of your providers have online portals. And I encourage you to sign up for those online portals. Also, familiarize yourself with Maryland's Health Information Exchange, which is called CRISP. So what CRISP does, it allows providers and healthcare facilities the ability to see your information and records, whether that healthcare was provided at their same organization or not. So let's say, for example, all the providers you see are within the Johns Hopkins health system. But something happens and you need to go to the ER, and the closest ER is the University of Maryland. The physicians and providers at the University of Maryland can pull up CRISP and see all your records and health information from all your doctors that are associated with Johns Hopkins. CRISP is an opt-out system. So your information is automatically inputted into CRISP. If you want to opt out of that, you need to complete the CRISP opt-out form. I encourage you to review your medical records and your insurance claims often. So you're looking at your medical records to make sure all the information in there is correct or nothing is missing. If your information was breached or accessed, you might first discover that if you see an odd insurance claim on one of your statements. You should be using strong passwords for any medical portals. Most of those portals will require you to use strong passwords. You should be using strong passwords with anything, but especially with medical portals. And then it's also important to not use the same password for every medical portal. You should be using unique passwords for each medical portal. One of the largest ways that breaches can happen is by clients and patients and coworkers and employees reacting to either emails, phone calls, or text messages that are considered phishing. So in the next slide, we're going to look at an example of a phishing email. So this email appears in your inbox, and it says it is from Fusion Health. And yes, that is a healthcare or a company that you have dealt with, so it's familiar to you. But you can see it's asking you to do a few things. So right away, you should be looking for red flags to see if this email could be considered a phishing email. So the first line of the email you will see from Fusion Health, and then the email address is noreply@healthcaremessages.com. If this email was coming from someone in the Fusion Health system, you usually would expect to see the email address at Fusion Health or something that relates to Fusion Health, not this generic healthcaremessages.com. Next thing you might want to pay attention to is the logo and the name Fusion Health. So in phishing emails, you want to pay close attention to the logo. Oftentimes, phishing emails can just have a slight variation to the logo that often tricks people into thinking it's really coming from who it's coming from. Also, if you notice on this email, at the end of the H in health, you'll see a little half circle, which is the copyright symbol right there. If this email was really from Fusion Health, that's not going to be cut off. They're going to make sure that that copyright symbol is clear and in its entirety. So that's another red flag that this email probably is not coming from Fusion Health. So in this example, you have no greeting. It just gets right to what they want you to do. In phishing emails, one of two things normally happens. So one, the greeting is very generic. It just says, "Dear patient, dear client, dear sir or ma'am." Or the greeting looks different. So for example, the word dear might be in the same font that the body of the email is in, but then my name, Jennifer, might be in a completely different font. It might be bolded. It might be larger than the rest of the type in the email. So that's another trigger that might say to me, this probably isn't a real email. The get started. So that's a button that they want you to click on. If you hover over the get started button, you don't click on it, you just hover over it, you will be able to see what link it's taking you to. So again, if you're getting an email from Fusion Health, you're likely thinking that you should be taken to a website that is either fusionhealth.org or .com or net, whatever URL they use. If this is a phishing email and you hover over the get started button, that URL that shows up is going to be either something very generic or something not related to Fusion Health at all. So again, that's another red flag for you that this is probably a phishing email. At the bottom, the please note, failure to comply with this request can lead to temporary suspension of access to our online banking service. So emails that are urging you to do something fast, if it's threatening, if you don't do this, something is going to happen. Again, those are likely red flags that this is a phishing email. Other things to pay attention for, grammar and spelling. Sometimes that is not accurate. If you look at this email and you look at the second paragraph, that last sentence, this will prevent authorized access to your account. Authorized has an S, where normally we use a Z in unauthorized. So pay attention to the grammar and spelling. So everything we talked about in this email are potentially red flags that this is not a legit email and they're trying to get some type of information from you. If you're not sure if this email would be legit or not, you should call Fusion Health. But do not call any number that is listed in the email, because likely as this is a phishing email, that phone number would take you to the phisher themselves and not take you to Fusion Health. So you would Google Fusion Health's phone number, or perhaps you have a Fusion Health number from a provider that you see. Call one of those numbers, not any number that is provided to you in the email. And then what can you do if your PHI was either exposed or you're being denied the access to your PHI? So I first recommend that you either start with the healthcare facility or the provider and you contact their privacy officer. Sometimes they will direct you to their compliance department. Other facilities call it the risk management department. Any of those that you're directed to or you contact should be able to help you out. If you're not satisfied with how the privacy, compliance, risk management is handling the situation, you as a patient or client have a right to file a complaint with the Officer for Civil Rights. So the OCR is the place that is responsible for looking into complaints and ensuring that the security and privacy rules are being followed. And lastly, I recommend that you sign up for credit monitoring. So unfortunately, we've probably all received the letter in the mail, whether it was from a healthcare organization or not, that a certain amount of our information was recently exposed or breached. Often, large companies will somewhere in that letter explain that they are offering 1 year free credit monitoring. Sign up for that. Take that opportunity. It's nothing, it's not going to cost you anything, and it provides you the peace of mind that you now can have credit monitoring being done for the next year to ensure that if any of your information was compromised, that you know if it's potentially being used to do something harmful to you. So thank you for your time today. If you have any questions, feel free to raise your hand or type them in the chat.